Did hospitals hide the true cost of care? The Trump administration is now demanding answers. Several Delaware hospitals have been warned for failing to clearly disclose medical prices to patients. With penalties reaching up to $2 million, healthcare transparency is taking center stage. The goal is simple: give Americans the power to compare costs before treatment and avoid unexpected medical bills. Will this finally bring fairness to the healthcare system? Stay informed, ask questions, and know your rights as a patient. Because when it comes to your health and your money, transparency matters.
The federal government is cracking down on healthcare facilities across the country, targeting hospitals that fail to make their pricing structures clear and accessible. Official warning letters have reached more than 500 different hospitals as part of a wide-ranging federal audit. The stakes for ignoring these notices are high. If a facility refuses to comply and open its books, it faces an annual fine of $2 million. That threat has landed squarely in Delaware. 4 local facilities have been formally targeted: Bayhealth's Kent Campus, Rockford Center, Tidal Health Nanticoke, and Christiana Hospital. Christiana Hospital stands out on this list. It is the busiest medical facility in the state, and its administrators are now holding a federal warning demanding they fix their pricing data. By utilizing these multi-million-dollar fines, the administration is attempting to force a sudden shift in how medical institutions conduct their daily business. Christiana Care already hosts a digital price transparency tool on its website. A search yields a specific sticker price: $27,304 for an appendectomy at Christiana Hospital and $30,480 at Bayhealth. If these multi-thousand-dollar sticker prices are searchable online right now, the question remains: why is the federal government accusing these hospitals of hiding them? This regulatory sweep began in 2019 when President Donald Trump signed an executive order focusing on healthcare costs. The intent of that order was to eliminate artificially high healthcare costs by mandating uniform price transparency across the industry. After years of development, the federal requirements from that executive order officially took effect this year. With the rules now in place, the administration deployed an aggressive auditing operation, scanning thousands of hospital websites to catch any facility failing to meet the new data standards. For some, like Tidal Health Nanticoke in Seaford, regulators went a step further than a warning letter. They issued a CAP request, a corrective action plan, which is a formal demand outlining how the hospital must fix its transparency failures. The administration has escalated to policing the specific formatting and accessibility of hospital data, rather than simply requesting that prices be made public. The hospital industry has responded to this federal sweep, with the American Hospital Association stepping in to defend its members. Their primary defense is that the vast majority of their affiliated hospitals are already actively complying with the new federal rules. However, even the association's own senior vice president admits that the current pricing system is complicated and not working effectively for patients. A structural disconnect exists between what a hospital considers an available price and what the federal government legally recognizes as transparency. Because of that disconnect, American hospitals are locked in a high-stakes standoff with regulators over how medical costs are communicated. The government has signaled that basic online pricing sections, like the ones currently utilized by Christiana Hospital or Nanticoke, are legally insufficient. A senior administration official confirmed that this regulatory crackdown will continue to expand. The president plans to tighten the enforcement of these specific transparency standards over the coming months. The initial 500 warning letters represent a starting point, with many more medical facilities likely to be targeted shortly. Healthcare administrators face a choice. They must overhaul their digital pricing systems to meet the expanding federal rules, or pay the $2 million annual fine. This nationwide battle is a conflict over who gets to dictate the definition of transparency in the modern healthcare system.